Hello, everyone. I would like to introduce you to AssistMe. Our mission is to pioneer precision care, and we are starting maybe not with the most sexy case in care, which is incontinence, but it's definitely one of the top burdens in care homes. There are over 400 million people worldwide suffering from incontinence, and the prevalence is increasing with age. This is why care homes have 70% of people who need on a daily basis support with incontinence management, meaning checking and changing diapers, as well as bringing them to the toilet and other related tasks. Why is this a problem in general? Two things. One, that's the ratio between the caregiver and the care recipients. We're seeing ratios from 1 to 25 and higher. The second one, the real-time need is just not transparent because no one knows when the diaper has to be changed, which then leads to the fact that actually there's a routine-based process what the incontinence management looks like today in care homes. This brings us to this. This is the result of it. We're seeing high rates of secondary diseases, dermatitis, urinary tract infections, as well as pressure sores, which are really hard to treat and very costly. We believe that the care market is at the verge of a radical change because today's cost-driven approach has led to massive underserving of the market and leads to bad health outcomes for the care recipients. Of course, technology might not solve the problem of the bad ratio between caregivers and care recipients, but for sure it can improve processes from an efficiency and effective perspective. And in addition, it can give transparency to the real-time need of the care recipient. If we make this real-time need accessible to the caregivers, they are then actually empowered to positively influence and impact the health outcome of the care resident, which leads us to the fact that we can move away from this cost-driven approach to a more value-based and outcome-based approach, also in reimbursement. Our solution, AidMate, is an IoT solution for care and is exactly focusing on the fact that there's a knowledge gap about the real-time need and that we want to make outcomes transparent. We are taking a simple incontinence pant and creating a connective link out of it between care recipient and caregiver. We have developed a printed sensor technology, also patented, attached to the incontinence product, which then detects the urine or the stool excretion of the care recipient, sends the information via cloud straight to the end device of the caregiver, who then can actually deliver care and support the care recipient in a more targeted, in a timely manner, not on a routine base. We have tested our solution already in care homes, and we saw what our system can actually achieve. We see a 70% reduction in the time people have to spend in wet or stool-contaminated incontinence products. But this is not the only potential of our system. We have multiple sensor technology integrated, and of course we can use machine learning on our historic data in order to predict the care need in the future, and we can include further functionalities and use cases such as fall prevention or repositioning management, for example. This sets us apart from the very few competition we have actually in the market, which either doesn't have a product yet in the market or is focused on a single use case, which is incontinence care. We personally believe it's not a feasible solution for a care home because the care process, the routine process, includes a lot of different components of care. And if we are not considering that, we are not able to move away the caregivers from routine care to a targeted need-based care. What does the market look like? We are targeting 13,000 care homes in Germany and over 90,000 care homes in mainly the European market, the US and Japan, which adds up to a market size of almost 2 billion euros. Our business model is twofold. On the one side, we're going to license our IP of the printer sensor technology to incontinence product manufacturers, because we do not want to manufacture these products ourselves. Our expertise is IT. We are developing hardware and software and working on further development of the sensor technology, and we will equip the care homes with this IT and offer the services. If we look on the projection scale, in 5 years, we want to have a revenue of 86 million euros. And in year 2, we are hoping to become profitable, having a market penetration in Germany of 2%. This is our team, multicultural, multidisciplinary. We have high expertise in software and hardware development, but also in healthcare. And we have an outstanding advisory board. We are belonging to NBT, the startup company builder for IoT. And we have investors from the Brückenköpfe, which have a long experience in the German healthcare ecosystem. From the timeline, we have patents filed in 2017 and currently are in process of filing a second patent. We have raised investment from public and private sources already of 1.8 million. And currently we are in discussions with incontinence product manufacturers and distributors in order to prepare mass production as well as the market launch strategy. We are looking now forward to another capital round of 2 million in order to finalize our product and in order to set us up to become a medical device company and prepare the market launch. Thank you.